good morning once again, and thank you so much for joining us on the Morning Grill. I hope you really did enjoy the newspaper headlines we wrote out for your viewing pleasure, so that you can go to the market and get your own copy and know more the details about them. This morning, we are doing something different, and I have here a doctor of repute. It is my pleasure to introduce or announce the presence of this doctor. He's a medical doctor par excellence. He possesses special knowledge, special skill, and professional capabilities in the surgical care of female reproductive system and maternal fetal medicine. He's a consultant. He's an obstetrician, a gynecologist. He's a fellow of the West African College of Surgeons with certifications in minimal access surgery and fetal imaging or sonography. I'm talking about a man whose educational training spans 3 countries: United States of America, England, or Britain, or Nigeria. He currently consults with the Imo State Teaching Hospital here and a full-time lecturer with the Imo State University. I'm not talking about any other person than Dr. Onyeka Uzoma. Doctor, good to have you on the show.
Hey, Joe, it's my pleasure to be on the show.
I'm excited really to have you here. I don't know about you.
It's a privilege to be on the show, and I think it's going to be a wonderful time we're going to have today.
Of course. All right, yeah, of course. I'm really happy that Doctor is here. Like I said, you will know why I introduce him as a doctor of repute, because he has special knowledge to disseminate. So I urge you to please stay glued to this television set while I interview him. Doctor, something really got me interested about this topic I wanted to talk about now. I have a friend of mine. In fact, I lost her to cervical cancer. So that really got me interested in this topic, cervical cancer. What can you tell us about cervical cancer?
Okay. In a nutshell, cancer of the cervix or cervical cancer is a malignant process that involves the lowest portion of the uterus, which many women refer to as their womb. The lowest portion of the womb is the uterus, is the cervix. And malignant transformations that take place there are referred to as cancer of the cervix. The key thing I want you to take note of is the fact that 80% of cases take place in the developing countries like Nigeria. In fact, WHO estimates put the death toll from cervical cancer at 300,000 every year, with new cases appearing at the rate of over 500,000 new cases appearing every year. So you can see it is a public health challenge that is real, more especially in a resource-constrained environment such as ours. So there is a need to broaden the awareness and to emphasize the fact that it is preventable. These deaths are unwarranted. 9 out of 10 of these deaths are happening in our environments, the so-called low to medium income earning countries. So it's not a disease that just you wake up in the morning and develop. The pathway to health, from health to disease, is clearly defined. In fact, it's one of those cancers, it's described as one of those cancers that is very preventable and very curable. So
really, I was going to ask about that,
okay,
if it's really preventable, but I think that will come up later, and then you tell us how it could be prevented.
Okay.
But meanwhile,
yeah,
now you're talking about the cervical cancer, and then you don't just wake up to have it, right?
Yep.
Now, what are the things to see to check for the signs of the cervical cancer, like the symptoms?
Okay. Before I hit the symptoms,
okay,
let me go to how it progresses from you having a woman who is healthy on one hand to a woman at the other extreme who has cancer of the cervix. Basically, this is one cancer that is caused by a virus, the human papilloma virus, HPV for short. Okay, so persistent infection with this virus is known to cause cancer of the cervix. So the question now arises, how do you get in contact with this virus?
Good.
Well, it's sexually transmitted. It's also transmitted skin-to-skin contact, but predominantly it's a sexually transmitted infection. And it's estimated that 75% of both women and men will come in contact with genital HPV infection during their lifetime. So you can see that the risk is there. Over time, the virus causes changes within the cervix, so the cells become abnormal, which we refer to as dysplasia, and it comes in stages: the mild, the moderate, and the severe, which we currently refer to as CIN1, CIN2, and CIN3. CIN is a short abbreviation for cervical intraepithelial neoplasia. Okay? At that point, the changes are occurring within the lining of the cervix. Broadly speaking, there are two types of cancer of the cervix. There's adenocarcinoma, which is the rarer form, and the squamous cell carcinoma, which accounts for the bulk of the cancers we see. So the central thing going on there is persistent infection with the human papillomavirus. Okay? So the symptoms a woman should look out for: initially, the pre-cancer lesions, the CIN1, 2, 3, have no symptoms. But they can be picked up if you're doing routine screening. That's why I said it's very preventable. The early stages may or may not be symptomatic, but the symptoms we know that are red flags that if any woman has, she should go see her gynecologist are: one, if a woman is having watery, blood-stained discharge that is foul-smelling. The key is foul-smelling.
Okay.
In fact, once I run into women who present with that complaint, I stop and ask the students I teach, what do you think is the diagnosis?
Okay.
Because it screams out. It's one of the symptoms that shouts at you that, look, take a look at this woman's cervix. There's something going on. Then other symptoms include pain in the pelvic region, bleeding after coitus or after having sex is also a red flag. So these three symptoms, there are others which may or may not exist. Okay?
Okay, now let's say that one is observing the signs now at the early stage.
Yes.
What necessary steps is the person supposed to take in order to curb it from, growing?
Okay, the beauty of it is, as I highlighted the fact that it's both preventable and treatable.
Good.
Treatable if caught in the early stages. They're basically, okay, if we're to stage cancer of the cervix, we have stage 0, which is the pre-cancer. Stage 1, which the cancer is still restricted to the cervix. Stage 2, it begins to spread to what we call the parametrium and the upper vagina. Okay? Stage 3, which is a more advanced lesion, where it begins to spread to the sides of the pelvic wall. Then stage 4 is like we're entering the end game, so to speak. It invades the organs in front and the organs behind, which are the bladder in front, the rectum behind, and it throws up metastases, little seedlings to places like the liver and other places. So in the early stage, like stage 1, very curable. Okay? Advanced, that's when we have the tragedy. We talk of palliative care instead of aiming for a cure. So in the early
and then in stage 2?
Stage 2, yeah. The survival rate is still it's still acceptable.
Okay.
It's when you cross to stage 3 that it becomes, the prognosis begins to take a nosedive. Okay? Stage 3 upwards, the prognosis is not so good.
Okay, it's not so good.
Yes.
Okay, like that's why they said, sometimes I've heard a lot of people say that cancer is not treatable. Cancer is not treatable.
Okay.
Yeah.
It's good you're saying it.
Yeah, that's what they said, that cancer is not treatable. So now, when it leaves the stage 0, stage 1, stage 2, and stage 3, will it now be curable? What can be done?
Up to stage 2, yeah. You can get cured. Stage 3, it's neither here nor there. You may not.
Okay.
Stage 4, basically, we're just keeping you alive and making sure you have dignity while you pass on. No matter how aggressive the treatment is, the survival rate is very, very low for stage 4, especially stage 4B, which represents distant lesions in other organs.
Okay, now, if an individual is, well, in case you're just tuning in, you are watching Orient Television Channel 59 Owerri, or on Star Time Channel 113, and we are having an interactive section with a doctor. He's a gynecologist, he's a consultant, he's an obstetrician, so he is here telling us about cervical cancer, what could be done, how we can prevent it, the stages, and what we should know about it. That's actually why we are here. So please, now back to you, doctor.
Yeah.
In case now you have a friend, okay, let's say a woman dies of cervical cancer, and then the daughter, is there any relationship between that? What can the daughter do to prevent, that from occurring? Because they said sometimes it runs to the blood. Like you said, okay, if your mother dies of high blood pressure, then definitely you may have a high blood pressure or diabetes, something like that. And I will say, okay, mind what you eat, mind, the kind of carbohydrate you take in, so that you won't get diabetes. Now, in case of cervical cancer, if a woman gets it and then the woman dies, is there any likelihood that the daughter will have it? I want to know.
No, it's a beautiful question, actually, because the idea behind this whole program is to put out the right information.
Sadly.
The nice thing is, unlike the cancers you've mentioned, breast cancer, for instance, which breast cancer, ovarian cancer have a hereditary background, cervical cancer doesn't.
Cervical cancer doesn't?
It doesn't. There's no inheritance. But basically, if you've had a relative suffer from it, it would be a tragedy if you too suffer from it. Because the truth is, as I said, okay, there are two keys to prevention. Because we've been saying prevent. We've not hit the nail on the head. And I want to also highlight the fact that cervical cancer ranks number 2 as the most common cancer amongst women in Nigeria, just behind breast cancer. So when we're saying cervical cancer, we're not just talking rubbish. After breast cancer, that we all know is a scourge, the next big thing is cervical cancer. It's there. So the first step is vaccination. The vaccines, which actually give you 70 to 100% protection against developing cancer of the cervix. The target age range in the past was children aged between 9 to 26, but currently the Center for Disease Control, CDC, recommends that it should be given to women between the ages of 9 to 45. You can see the spectrum has increased. And there are 3 types of vaccines. They are available in Nigeria. In fact, the vaccines were introduced and licensed in 2009 here in Nigeria. They were introduced globally in 2006. So you can see 2006, 2003, we got on board. 2006 to 2009, 3 years later, we got on board. However, the tragedy is the awareness doesn't exist. It hasn't been integrated into our National Program for Immunization, the NPI. Unlike in most countries, I'll give an example, Canada. The HPV vaccination is integrated into the national program. So at whatever age you are, you get the vaccines at the right time. The second key to that's primary prevention. Secondary prevention is the screening. Many women have heard of pap smears. That is one form of testing. Another form is the liquid-based cytology. Another form is visual inspection with acetic acid, which actually was designed for the resource-constrained countries. And it's so simple and so cost-effective that it will work across the board in any community. I could literally train anybody to do a visual inspection with acetic acid and to say this is a normal screen versus this is being normal. So those, in addition to that, HPV testing for the virus itself is also a screening method. The age at which screening starts varies from country to country. In the United States, it's 21. That's the starting point, to 65. They do 3 yearly screening. In the European countries, they start roughly by the age of 25 to 65. Australia, 25 to 65, with exit testing between 70 to 75 years of age. Unfortunately, Nigeria has no national protocol.
Wow.
So that is the tragedy of our home country. The knowledge is there, the awareness is there, the experts are there, but there's no national protocol.
So what can be done about it?
Sensitization, advocacy, what we're doing right now.
Okay.
Putting out the knowledge. Sensitizing the masses, telling them that, look, there's no need for you to. In fact, in this day and age, you have no business having cancer of the cervix. Okay?
Really?
Yes.
Okay, now, like we know actually that once you want to go for a breast lump, a breast cancer check, you have a word. Now they said, okay, check for the lumps, check your left, check your right.
Okay.
Now you mentioned if the person is bleeding, you have pain on the pelvic region. Does it mean that once you start having those symptoms, you are on the road to cervical cancer?
You might be on the road to cervical cancer way before those symptoms manifest. Remember I said we have pre-cancer lesions. It's those pre-cancer lesions we want to catch during screening.
Okay.
If we catch them, we treat. In fact, WHO advocates screen and treat.
Okay.
So once you screen a woman and you see either mild, moderate, or severe changes going on, you treat immediately. That basically cuts the risk. In fact, you've short-circuited the pathway to cervical cancer. You've saved a woman's life. Then, of course, after treating, you follow her up. Okay, so I think with vaccination and screening.
And the vaccination is available?
It's available.
It's available here in Nigeria?
Yes, it is, but as I said, the problem is the awareness is so poor. There was a study done in Enugu recently, and they actually sought the opinions and the knowledge amongst healthcare providers across board, not just the specialists like myself. We're talking of nurses, the paramedical health workers, and they found out that only 20% had knowledge of the existence of this vaccine. Then they interviewed parents, and they found out that only 9% had knowledge of the existence of the vaccine. So with this kind of poor awareness, there's no way forward except the word is put out.
And you know, someone can be having the as in cervical cancer symptoms without knowing that this is what he or she is experiencing, right?
Yes, and that is there lies the tragedy of cervical cancer in our environment. The women that eventually present late, so they end up dying.
Wow.
As I said, 9 out of 10 of the deaths occur in the poorer countries. We're not poor, by the way. It's just that we haven't gotten our priorities right.
We have all the resources. We have everything to make us rich,
yes,
or to call us to rich countries. But we are not making judicious use of it.
Precisely,
I think that's
precisely.
Yeah. Now, how common is this?
How common is cervical cancer? As I said, in Nigeria, the statistics currently say that yearly we see about 9,900 new cases. Then the deaths from cervical cancer are about 8,000 per year. But if we factor in the fact that we have a poor health-seeking culture, we have a lot of people who don't know what to do with women who present with whatever symptoms they present, the number of qualified, skilled, and trained staff to make the proper diagnosis is just not there. Women who are basically affected in most families in Nigeria, it's the man that takes the final decision as to whether you will go to the hospital
or not.
So the women don't have the empowerment.
It's pathetic.
it is that these are real things. So by the time you factor in all these, you find out that the official figures are a gross underestimate. How many people actually have access to regular health care? Less than 10% of the population. So if these statistics represent 10% of the population, and we're 200 million people, do the math. We're talking of close to 80,000 to 100,000 new cases yearly. We're talking of at least 50,000 deaths per year. Preventable deaths. Okay? So, a little bit more on the vaccine, because there's also a need that people know more about the vaccines. There are 3 different vaccines available.
Good.
All of them are effective, but the efficacy varies. You have Cervical, which is what we call a bivalent vaccine, which means it covers for 2. Okay, let me take 2 steps back before I continue with that.
Okay.
Because HPV is not just one virus. There are about 150 different subtypes. Okay? But those that have been linked to cancer of the cervix are just about 13. Okay? 13 of them are the ones that cause the problem that we're looking at. So you have one of the vaccines that covers for the 2 most important HPV subtypes, HPV 16 and HPV 18. HPV 16 has been implicated in 50 to 70% of all cases of cervical cancer. So that's the elephant in the room. While its junior elephant, if I may use that word, is HPV 18, which is responsible for 7 to 20% of cases.
Okay.
There are others. So as I said, Cervical is a bivalent vaccine. It covers for HPV 16 and 18. Gardasil covers for these 2, and HPV 6 and HPV 11. One may ask, is HPV 6, HPV 11, are they carcinogenic? The answer is no. But they do cause an illness called genital warts, which is a sexually transmitted disease. So it offers protection against those as well. Then Gardasil 9 is the big dog in the house. Okay, it protects against 9 subtypes. The 4 we've mentioned. In addition to those 4, it protects you against the other subtypes 31, 33, 42, 51, and 58. So a total of 9. It's given 3 times. First contact, 2 months later, then at 6 months. And you're good to go.
All right, that's wonderful. Okay, but looking, when we started this show, you said you were talking about the people, as in, I wanted to ask you about who are at the risk of having this.
Okay.
Yeah, the people who are at risk.
Beautiful. It's important to discuss the risk factors. I'm glad you brought that up.
Exactly.
There are multiple risk factors. Number 1 being the human papillomavirus.
Okay.
Because it's not just you get infected once and you get cancer. You have to be infected persistently. So people who have multiple sexual partners are at risk because they are at risk of being persistently infected. Smoking is a clear risk factor in cervical cancer. A weak immune system predisposes you to an increased risk of coming down with cervical cancer. I'll give you a clear-cut example. Those with HIV are at greater risk of getting cancer of the cervix. And for them, the recommendations are slightly different. Once a woman is diagnosed as being HIV positive, it's recommended she be screened twice that year, within the year of diagnosis.
Wow.
Then yearly thereafter. That highlights the increased risk. Then those who pick up other sexually transmitted infections like gonorrhea, chlamydia, syphilis are at higher risk. Prolonged use of birth control pills. There's a study that showed that women who use birth control pills for well over 5 years, it tends to double their risk of coming down with cancer of the cervix. So if you're using birth control pills, you have to manage the timeline with which you use it. Then obesity is another risk factor. Okay. So.
Okay, we may not really have the time to outline the raw risk factors.
No, these are the main risk factors.
Okay, these are the main risk factors. Okay, associated with this. Okay. Now, the time is no longer on our side. Yeah, so
right.
well, I want to ask you this question just in a very few sentences. Can anyone who, which of the stage that will prevent an individual from conceiving if you are a woman? You know, definitely it's woman disease.
Oh, yes,
woman
yes,
disease.
Yes,
now, which stage? We have the 0 stage, we have the stage 1, we have the stage 2, stage 3, and stage 4. So which of the stage that a woman will be and the person will not conceive?
By the time you're at stage 4, I mean your body has taken a beating.
Okay.
The likelihood of conception is low. However, it must be stated that pregnant women have been seen who have coexisting cancer of the cervix. The question is, what do you do when you see a pregnant woman who has cancer of the cervix? You stage the cancer. You weigh the risk of carrying that pregnancy to viability versus treatment. If the risk is low, you carry the pregnancy to viability, deliver the baby, treat the lady.
All right. So now, thank you so very much.
You're welcome.
What is you deal with women issue.
Yes.
Now, what is the most challenging aspect of your job? The most challenging aspect of your job?
Sociocultural beliefs. That is one challenge. Another challenge is religious beliefs. Then the biggest roadblock to my work is economics, finance. A woman wants to be treated, but the money is just not there.
Wow.
Okay. So these are the roadblocks we face in treating women.
Okay, nice having you, Doctor.
It's been my pleasure.
It's my pleasure having you. Thank you so very much.
You too.
Yes, thank you. We want to do this again.
We will do it again.
You will do it again.
Definitely.
Like you said, sensitization is really very important, right?
Without a doubt.
Yeah, so that people will know and they take care of the health. Okay, dear viewer, thank you so very much. You just watched Orient Television, Channel 59, over there with Dr. Onyeka Uzoma. He's a gynecologist. He's an obstetrician. I hope you really did enjoy that side. We want to do this again. Thank you so very much for joining us on Morning Grill. And on that note, on behalf of the people that work with me, Kelechi Korole, Ike Aswalo is right here in the studio. Egochukwedo Onyeka is at the control room. I also want to recognize one of our staff here, Peggy Okodube, and I want to thank you so very much, Dr. Onyeka. Doctor, thank you so very much. Let's do this again.
Definitely.
I am Angel Ekenasi. Thanking you so much for watching. At 10 o'clock, we shall be going into the newsroom for Orient News Highlight. Good morning and stay with us.